us what happened with you and your own story when you started wearing your new apparel and your physiology.
Yeah. Again, when I was designing it, my number one priority was to get rid of the chest band for exactly the reasons you described. Because ever since my pregnancies, when everything loosens up, I had a lot of issues with like reflux and, things like that. And I noticed that my tight bra band would always make it worse. If I ate a big meal, or even if I didn't eat a big meal, but I ate a certain type of food, I'd get that reflux and stuff.
Yeah.
But it would go away if I took my bra off, right? So, and not to mention the chest band is tight and uncomfortable and you can't breathe and, all of that. And then also, almost as important, is the digging shoulder straps, right? Because when you look at bras, bra alternatives, sports bras, really anything, even when they say that the straps are wide, the straps are really never wider than an inch, maybe, if you're lucky. But an inch is exactly the width of the deep shoulder grooves that I was developing as a full-busted woman over 50, right? And that was one of those horrifying, like there's all these things that hit you when you pass 50 that you can kind of deny that you're aging for a long time. And then, it hits different women at different times. For me, it was definitely like the after 50. Then you start like cumulatively, you look in the mirror and it's like, what has happened? This is a different body. This is not who I think of myself, but everything's changing. And things like shoulder grooves, right? When I started seeing shoulder grooves, it was so depressing.
Yes.
And again, I have different feelings about it now, but in the moment, as we often do, we internalize the shame and the body hate and we think, oh, I look like my grandmother and that's awful, And now, well, I'll tell the story first and then I'll tell you what I think about it now. So anyway, shoulder straps were also terrible, right? So between the tight chest band and the tight shoulder straps and being over 50, I was having so many health issues that were exacerbated, right? The stomach reflex, the inability to breathe deeply, when I wanted to exercise, the inability to move my shoulders freely, when I'm doing yoga or Pilates. When you have a tight sports bra with tight shoulder straps, you don't have full range of motion.
That is so true.
Right? And then there's nerves under there. There's muscles, of course, and then there's nerves. There's important veins. Your vagus nerve, right, goes up through your torso there, right, where the stomach is and everything. So just intuitively, I felt like this is just not good. This is not healthy. So I think I talked in the last episode about the fact that as I started wearing Embrago more and more, I started realizing I didn't have to wear a bra. I still it took a long time for that to get past that sort of ingrained idea that I have to wear a bra.
Okay.
And once I realized I didn't have to, I started wearing Embrago exclusively. Like I have not worn a bra in probably six months, maybe more.
Wow.
And I did that just because it made me happy and I feel comfortable. And I have this one and done. I'm sophisticated, I'm chic, I'm put together, and it's one piece. And I don't have to do that whole bra juggle every day. Like, how big are my boobs today? And what bra is going to fit and what's going to fit in the top. So here's the surprise. I realized maybe, a month or two ago, I looked in the mirror after a shower and I thought, my shoulder grooves are gone. It was a complete revelation. And I was amazed because I know, again, having done all this research and looked at shoulder grooves and all the women who have these terrible shoulder grooves, people get plastic surgery to repair shoulder grooves, right? To cover up that aesthetic.
Yes.
And when I saw that my body had repaired itself, when I removed the offending object, right? When I removed the constrictive strap that was causing the injury. And again, when you look at shoulder grooves, you don't have to be a doctor to know that's affecting your nerves and your muscles, and fascia and everything, right? So when I realized that my body had repaired itself, I didn't have to do anything but just, take away the thing that was hurting it. It was another revelation. And so now when I think about what I went through, what I know millions of women go through when they look in the mirror and they hate themselves because they have shoulder grooves, because they think I'm too fat, I'm too big. It's the clothes' fault. It is not you. true. Like it's a blessing to have reached this age. We are so privileged to have reached this phase of life, to still be here, to still be able to use our bodies. And the fact that we have sacrificed much of the health and well-being of the physical body that we have, as well as our mental, our mental health, beating ourselves up about how we look. That just added more to my determination and to make this my mission to get out there and preach to women that your body is perfect and beautiful and knows what to do. You just need better clothes.
Oh my goodness. Again, so many light bulb moments going off just now. You mentioned the shoulder grooves. You mentioned the nerves. You've mentioned, I've been a victim myself of the shoulder grooves and going, oh, I must be gaining too much weight because now the shoulder grooves are getting deeper. They're getting worse. When you were saying this, I was just like, wow, sometimes, you have this tightness in your neck, the base of the neck here, because you have your trapezius muscle that comes and attaches to the base of your skull, and it spans a nice wide part of your back, and this strap goes right over it. Mm-hmm. And it's compressing. And so sometimes our headaches could actually be because of what is being compressed.
Exactly.
You think you mentioned in the last episode about when you're in your reproductive phase and you're cycling, you have this interval, you have this predictable rise and fall of your hormones in a set interval, which is your cycle, right? And when you have a rise of your estrogen actually stimulates breast tissue growth. It stimulates proliferation. So that's why we feel at certain points during our cycle, our breasts feel fuller. It actually helps when you're going into puberty. The estrogen helps your breast to grow. And so that's why there are times right before your cycle, if you don't have enough progesterone that is counterbalancing that, you'll feel breasts are swollen. They feel heavier. Your bras don't fit like they should, or they would like the week before. Like you're saying, you got to wake up and you're like, okay, where am I in my cycle? Which bra do I need to wear today? What am I wearing today so that I can wear the right bra underneath? All of that mental gymnastics that we have to do. And then I'm thinking of other structures, like we just said, the stomach. We talked about the diaphragm, the lymphatic system. Our lymph drainage comes up and it actually dumps into this little lymph chain. There's one of the big lymph chains that comes up right where our inferior vena cava is, which is where you have the blood return to your heart. And so if we're cutting off all of this nice flow and circulation or in that chest band, I'm learning a new term, y'all. I didn't know about the chest band part of the bra. You can be constricting lymphatic drainage and flow because now that is another area of constriction. So this is what happens throughout the day. We have this nice exchange of fluid in our tissues and our blood vessels that help to keep us healthy. And at the end of the day, if we've been compressed, it's just like stepping on a garden hose. That water's not flowing through the garden hose. So when you have on your traditional bras, you are not making these symptoms up or these feelings or sensations up in your head, women. You are not. This is something that is truly, truly happening. And I thank you, Karen, for this revelation, especially the grooves, the bra grooves.
Yeah.
That is huge, huge, huge.
Yeah.